My name is Rebecca Linville, and this is my applied project for class 593. I did my poster on a student at my school, and they have a target behavior of touching others. So they will reach out and grab someone, and it's not aggressive, but it's also kind of hindering their um, education environment. So here is my poster, and I will describe what I did. So for my project, as I said, started with my student, and they have inappropriate touching. So my research question was, will differential reinforcement, a DRA, of behavior reduce the frequency of inappropriate touching with her? The independent variable was the DRA procedure, and the dependent variable was the frequency of inappropriate touching. She's 16 years old and has autism. She also has an intellectual disability. And from my observations in the classroom before starting this project, the behavior was mostly attention seeking. So she would reach out, grab someone when she wanted their attention or when somebody was talking to another person and she wanted their attention on her. She, like I said, will engage in those behaviors. So I did a DRA with her, and I did the baseline data. So I just kind of went in, took data in her natural environment in classrooms. The sessions were 20 to 30 minutes. Most of them were 20 minutes. And I went in and I made tally marks on her data sheet. Her data sheet was a frequency table. So it had the date, the session number, the amount of responses that she could have, the amount of what phase I was in, if I was in baseline or the intervention, and then the amount of inappropriate touches she had, and then the amount of appropriate responses she had. I had her one-to-one take some of the data as well, so I could see if we were both seeing the same things. So we started out with the baseline. So it occurred in the natural setting, problem behaviors without intervention to establish that. I moved into the DRA, which was visual cards, or for staff to gesture to. So I would have cards on her desk that staff could point to for her to raise her hand or tap them for attention. And then we would go back to phase A. So we would withdraw the cards and see how she did with those without having the cards there to remind her to touch someone if she needed something. And then we would go back to, I went back to phase B, so I introduced the cards again. And what I saw with this was that you'll see in the graph over here, her baseline, she started out pretty kind of high with some engagement in touching others, ranging from 7 to 9 instances per session with no intervention. And then when staff responded, with staff responding naturally. In the sessions 4 to 6, the frequency decreased slightly. This was with the DRA in place and the visual cards in place. During phase A, the baseline phase, again, for sessions 8 to 10, the behavior decreased a little bit more. So we kind of saw her realizing or learning that she can ask for those things that she wants appropriately using the cards or asking for attention. In the second DRA phase, sessions 11 through 13, the frequency dropped to only 2 to 3 instances. So we saw her being reminded. So the DRA was working with her. Things that I learned was that the staff in the classroom kind of play a big role in this. So it was a big part of teaching Olive, and then also kind of reminding staff that the less verbals you give her, the better. So just gesturing to those visual cards so that she can really see and there aren't too many words going on in her head. Um, I noticed that the decrease um, in the DRA allowed for a decrease. And from what I found from research, they were suggesting that concurrent and serial DRAs are more effective than a single DRA. So having multiple things going. But some implications that I had from it were that the DRA in a classroom setting is will reduce the inappropriate behaviors and kind of reinforce those appropriate behaviors for her. The limitations were, like I said, the staff. So making sure that I'm going in for fidelity checks and that staff are running it correctly. Um, and that we're generalizing it to different areas of the school instead of just her home classroom. I did try and go to different classrooms with her, but for the most part, I stayed in her home classroom. What I learned from this project is that DRAs are helpful, and making sure that those replacement behaviors are appropriate for the student. So she does better with gestural prompts. So having something there that we can point to that she can see worked better for her. And that is my project. Thank you.